Art therapy is a type of therapy that not only uses talking, but also art and the creative process as a form of communication. Here in the US, it originated around the 1940s, when psychologist Margaret Naumburg named her field Dynamically Oriented Art Therapy. The term art therapy was also in other places around the same time period. For example, it was used in England in the 1930s. Art itself, however, dates back as far as cave paintings, showing that using it to express and tell stories has always been a part of our society. Now that you know a little bit about art therapy, let's talk about what art therapy is not, as there are a lot of misconceptions about the topic. Firstly, it is not true that the individual has to be artistically talented. In fact, art therapy has little to nothing to do with the technique. Also, it is not simply creating and the therapist interpreting it and telling the individual what it means. The client and therapist work together to discuss emotions, thoughts, and struggles through anything visual. This can include drawing or creating, but can also be done through exercises, other mediums, and mapping things out. These exercises and forms of expression can help a variety of individuals. Art therapy is often used at hospitals for those struggling with a chronic illness. For example, my sisters who have blood disorders have worked with their clinic psychologists. Since there are a lot of complicated emotions that come with a chronic illness, art therapy can be a way of expressing them. When it comes to disorders we discussed for the mental health unit, art therapy can be applied to many of them. Primarily, it is common for patients suffering with a disorder such as anxiety or depression to be hesitant of expressing themselves in words. Art therapy can take away this pressure. When verbal engagement is difficult, it can be a great way to get the patient to open up about themselves. It can also help find some of the sources of their issues through expression, which many prefer over talking. Art therapy can also create some amazing coping mechanisms for mood disorders such as bipolar disorder. These patients often alternate between mania and depression, experiencing some substantial highs and lows. Through creative expression, art therapy can help identify triggers for these behaviors, because when patients are experiencing these extremely intense feelings, again, sometimes verbal communication simply isn't enough. For example, exercises such as the ones shown on the screen are prompted with phrases such as, draw how you feel, or draw how you felt when a certain event happened. The patient draws what comes to their mind based on the prompt and their emotions, in this case starting with an outline created by a scribble. After getting this down, which can be quite therapeutic in itself, the therapist and patient can work together to dissect the patient's thought process, feelings, and actions. On top of this, other art therapy exercises can be used to explain someone's triggers or cycle, as well as mapping out coping mechanisms. These types of exercises can be applied to many disorders. Art therapy can also help trauma-related disorders such as PTSD. For patients with this disorder, it can be extremely hard to talk about their trauma. In fact, sometimes the patient may not even be able to fully grasp the entirety of what has happened to them due to repression. Art therapy not only helps patients who are unable to verbalize their experiences and feelings, but can also help to organize and process repressed memories by getting everything out on paper or other forms of media. With all of this in mind, it is clear that there are cases where art therapy may be the best option compared to other forms. For children and people who have experienced trauma, art can give a voice to emotions and feelings they have that may not be able to be explained through words. For these individuals, drawing how they felt can be way easier than describing an event. After drawing, the therapist can help them dissect what they've created, making it a starting point to discuss issues further. For example, this exercise was started with an outline of a human body and a prompt of asking the patient how they feel when they experience PTSD. This question would be phrased differently based on the situation, including the age of the patient. Although this may seem vague, the therapist can point out certain things about the drawing, creating a conversation that might have been hard to start from a blank slate. An example of this would be the scribbles in the knees. The patient could explain that their knees feel weak and trembling. Together, the therapist and the patient could possibly conclude that while their trauma was happening, the patient felt weak and unable to protect themselves. Recognizing this can lead to treatment and more coping mechanisms.